On today's episode of Dance Med Spotlight, I get to speak with Bethany Shum. She is a chartered physiotherapist and performing arts medicine specialist, mainly working with circus artists, cheerleaders, dancers, and acrobats in London. She's the founder of Flexibility Matters Physio in London and works with the National Center of Circus Arts and is the co-host of Growth Through Movement podcast. Through this episode, we talk about a lot of different things, as we usually do, thinking about the ideas of no pain, no gain, or it's normal to have pain in the performing arts. How do we differentiate what is normal and okay versus maybe more of a problem and needs a little bit of a checkup? We talk about hypermobility, especially as it shows up in things like circus arts and more. So to find out about all of those things, make sure that you listen to the whole episode. Welcome back to another episode of Dance Med Spotlight. I'm super excited for today's guest, Bethany Shum. Welcome.
Thanks for having me. So excited.
So the very first question that I always ask folks on the episode is, what got you where you are? What made you interested in working with performers and in performing arts medicine?
I felt like my journey started at a very young age, and it comes from like a very deep kind of value and purpose place. So when I was little, I've always been really active. I was doing gymnastics, I did a lot of cheerleading, so lots of performance-based sports. And then with the interest of just wanting to help people led to me becoming a physio, but I didn't realize there's a whole field called the performing arts medicine. I do feel like through my years of injuries when I was like a teenager kind of age, it does feel like a lot of health professionals didn't understand like the demands of what I needed to do to dance, to get thrown in the air. And it's not just getting back to walking, and that's not enough to get us back to like that kind of higher performance stuff. So I became a physiotherapist, and about 2 years in, I started to feel a kind of a misalignment in what I wanted to do and how I wanted to be in terms of my values in my life. So I've noticed I'm London based, and there's a course called Performing Arts Medicine at UCL, and it sounds fascinating. And as a young adult, after stopping gymnastic cheer career, I fell into circus. So I always had that idea of, what if I can be the physio for the circus community? So that idea stuck. A few years later, I was actually before I had the gut to shift specialty. I was working in chronic pain, and the more I work in chronic pain, the more I'm like, this is not where I want to be. I really want to get a change in my life. And that led me to studying performing arts medicine. I've done some research for pain and acrobats, and hopefully a paper will be publishing soon.
Yes.
It's a long process. And now I work with the National Center of Circus Arts and Performing Artists full-time in central London. So it's a pretty long journey. But there was definitely moments of physio career I felt like I didn't want to be a physio anymore because I was just tired of hearing problems. And turns out I was just not in the right community.
Well, and I imagine that the experience in the chronic pain world has been helpful working with performers, because I feel like a lot of them, and we'll get into this more, but because there's such of this idea of no pain, no gain, or it's normal to hurt because I'm doing these things, they're dealing with chronic pain. Maybe they're just not calling it the same because they think it's normal and expected.
That's so true, because I think lots of people don't know the definition in terms of chronic pain science. It's only 3 months. If you live with pain 3 months, it doesn't go away. That is a chronic pain condition in itself. And if you think about the dancers and the performers we work with, like so many of them would actually fall into that criteria. But our thoughts and beliefs really shape our perception. And this is like where the neuroscience becomes very interesting. If someone's believing that no pain, no gain, this is part of the performance life, it's more likely that they will push through, even maybe to the point that's like not healthy for the tissue, not because they often say, I'll have a really high pain tolerance because I'm a circus artist, I hang in the air. But yeah, I think it's hard. It kind of, the conversation about the load management, you really have to kind of think it quite holistically, and because that no pain, no gain mindset, sometimes it's helpful, but sometimes it's actually causing more harm than good.
Definitely. I was talking with somebody recently, and, especially if we're talking about younger performers or folks who are newer to the performance world, there can be this, your body's adjusting to new things that you're asking of it, or maybe you're trying a new skill or new technique, and your body's letting you know a little bit, but learning the difference between that my body's just adjusting type of pain versus the maybe there's actually a problem or I'm doing damage with the pain that I'm experiencing can be hard to navigate if you aren't, helped to figure out what those definitions are for you.
I know, because that's actually part of my papers when I was reading, like doing the research on, because there's the medical language and then there's kind of the performance world language, and you try to like merge the medical evidence-based side to what the people actually use. But generally, they do say some good pain and bad pain. I know it's very black and white, and pain is like 50 shades of grey. It's not black and white. But yeah, like being able to identify and self-check in for like which is a good pain from learning new skills, your body adapting, creating some muscle soreness, the DOMS, is definitely different to pain that's like injury related or inflammation related or tendon pain, that sort of thing.
What are some of the conversations that you maybe have with performers when they're coming in and talking about this pain, trying to navigate, like, is this normal? That sort of stuff.
I think I don't know, everyone seems to do it differently, but I really just try and actually listen and let them tell their journey. Because if you hear the history, I'm sure you might probably relate in a really in one way or the other. But if you really listen to like when the pain start, how the pain start, how long does it last, the aggravating factor, the 24-hour pattern, it gives a really good indication of which category that is the source of the pain. And then I found just reflecting back to them, this is the journey, and given your story, this is likely that it's because of this reason. That without them really going through or prompting the right questions, I think sometimes it can be really challenging to just say, I've got pain here, is this normal?
Right.
Pointing to like the wrist or shoulder. And sometimes it's not just the wrist or the shoulder, or like it's the body parts above and below. And they're just so many factors, as you know. The nervous system, we haven't really touched on that. The sensitive nervous system also really plays a part for pain as well.
That's one of the big things I've figured out in my career as a physio too, of, if somebody's coming in and they're over caffeinated, underhydrated, didn't sleep well enough, stressed about work, their pain is going to be very different than someone who is well rested, well hydrated, all of those other things. And kind of hearing a little bit about, well, how have things been lately? How has your day been going? Can also give me an idea of how we're going to approach things in that session, because I have a sense of, is today a day where we're feeling good and our body is working the way that we want it to, or is it a day where our nervous system is screaming at us and just not happy?
Yeah, we're kind of I think we kind of become like therapy, like not just physical therapy in a sense, isn't it? Because knowing all the social side or the emotional side, the psychological side is a huge part. You can't separate the physical and emotional pain and thoughts around it. So yeah, I think it's really important that we do that as well. So yeah.
Yeah. What are some things that you have maybe seen, whether it's in dance, circus, maybe any performing group and community, that are maybe some misconceptions about pain or injury?
Oh, I think there's different conceptions in different communities, and the anxiety and the worry is very different. Although they're all performers, but they use their body very differently.
Yeah.
I see quite a few musicians in London, and I noticed that there's actually quite a high prevalence of hypermobility in musicians, which you wouldn't think. You would just think, okay, dance is very bendy, and then they do all this bendy stuff. But the misconception around the performer who's a musician and around pain, I feel like they catastrophize a lot, more so than I would have expected, because they use the body as an instrument. They literally, if they can't play with their hands or the shoulder, hand holder, violin or something, then that's the career done. So the catastrophe was huge. And there's lots of perfection of traits in that community as well. So a lot of potentially like shoulder pain and neck pain, it feels like from a physio perspective, there might be a bit of tension, a bit of stress, a bit of imbalance. You increase your playing, so it's normal that you feel a bit tighter. You might get some knots here and there, but it's because they don't have the same kind of dance training. They don't know how to warm up. They don't know how to cool down, and they feel this pain is like the worst thing in their life. I'm sure dance are something similar, but I think that the context is a little bit different. I think dance is more about, I notice it's more like, how do I get back to show? And the motivation and the readiness to do the right things is very high. Whereas musician has a starting point of, oh my goodness, it's done. I'm screwed. I play music all my life. There's nothing else I can do.
Yeah. And I can definitely see that, because I mean, even just looking at the dance world, I feel like we're still sort of in the beginning phases of people understanding that you can rehab through some of these things, that you don't have to deal with pain, that there are people who specialize, who can help, that there is hope in the end, and all of that sort of thing. And we're not even that far into that process compared to, soccer players and hockey players and whoever else. And so I feel like musicians are even earlier in that spectrum.
I know. I think musicians, just the awareness is really hard to raise, and the way that the institution has kind of developed musicians is very different. I think it's getting better. Like some institution in London has started implementing kind of performance mindset, and also around like moving your body, just like general physical health. I think the more these are drip feed, I think the awareness will eventually, hopefully, comes. It doesn't change in a day, but yeah, it's interesting though. I think that's the one thing that surprised me a little bit when I started working in the performance career.
Yeah, I know. I grew up playing piano and guitar and different things, and I mean, we never had warm-ups or things of like, well, you've been hunched over the keyboard for a while, maybe you should do some things to get yourself moving the other direction. Or, I mean, that was never anything that we talked about.
And when we're little, you might be taking classes that's like half an hour or an hour or so. But for the professional, they might be rehearsing for 3 to 5 hours, and then a show for another 3.5 hours. And then you wonder why the neck hurts, or like why the guitar like fingers hurt. And if you're hypermobile, like you're getting collapsed like fingers as well. There's like, and then when you tell them that, they're like, oh, I didn't know that.
Yeah. Let's switch gears a little bit, and I want to hear more about the work that you're doing and the organization itself with the National Center of Circus Arts. So for folks who are not familiar with the organization, can you tell us a little bit more about it?
So I've been working at the National Center of Circus Arts as a physio and a lecturer for the last 3 years now. Essentially, there's professional ways that you can train to become a circus artist. It's so cool. You can just spend 3 years in a university, and by the end of it, you are a circus artist, and you can go touring, you can do shows with the skills and discipline that you choose. There's only one university in the UK that does the whole 3 years degree program, and it's actually like you actually get a degree by the end of it. And a lot of circus places might be self-trained, or they insert this layer. A lot of them are like high level GB gymnast turns circus artists. So the organization I work with are pre-professionals. They range around mainly 18 to 21, but there's kind of mid-20s and early 30s as well, but less so. And the people there would generally do kind of all the circus skills in the first year. So they will learn about tumbling, they'll learn about juggling, they'll learn about climbing on a rope or a silks and just being in the air, how to rake safely, all that stuff. And then the next 2 years, people specialize. So they pick like a discipline and then they train that discipline quite hardcorely 2 years. So yeah, that's based in central London. It's a really awesome place.
Yeah, it sounds amazing. So then tell us a bit about the work that you do there. Is it something where it's regular clinic hours to support the folks in the program, things on site? What does that look like?
Yeah, so I do a mixture of things, but essentially it's one day of my working week. It's also the day that I'm probably most passionate about. I mean, outside of that, I run my own physiotherapy clinic, but I love my circus work. In the morning, I lecture the first year. So we do anatomy and physiology lecture. Every week you learn a part of the body. So actually we have a lecture on chronic pain and pain as well, and differentiating the type of pain. So speaking of which, so all the first year gets 2 terms of anatomy and physiology lecture. Each year they also get a medical screening day. So then you get an idea of what other new injuries are there or things that you need to be aware of or any medical stuff that needs like attention on. And then in the afternoon, I do a clinic for the students. So I do one-to-one physio for the students for any new injuries. There's a lot of hypermobility there. Basically, I think 80% of people there are hypermobile. It's quite, maybe even more. It's quite high, the number. Following that, I still have like 2 hours right at the bottom of the day that I started this year, basically open up to professionals and teachers. So it's a whole day of essentially a circus physio day, really.
That's awesome. And there really is something when you get to have those days where like the group that you're really passionate about spending time with, or a discipline that you're really interested in, it can be so energizing to be in that space. Even if it's a long, busy day, it feels totally different.
It feels like, yeah, this is why I do what I do.
So important to have.
Yeah. Otherwise, I would be dead at the end of the day.
Yes. So I know you said that hypermobility is really common within that population. And, when we're thinking of dancers or some other performers, we see a lot of it as well, but I feel like it's a different beast, a different thing to have to handle. Thinking of circus, where we're also seeing a lot of upper body involvement and things like that. What are things that you're noticing in particular in this group?
I think in this group, there's a lot more upper body injuries, like wrist and shoulder. It's quite common, and the things that people come in terms of pain and injuries. Whereas dancer is generally a bit more lower limb. There's a few ankle sprain, but they are often like gymnastic or tumbler, where they like twist their ankles. Often, sometimes not even in the class. It's after the class they roll off the mat or trip on the curve. That has happened as well. Someone's sprained their ankle because it slipped outside of circus uni. So those are the common things that I see. I found the shoulder instability sometimes really hard to manage. It's interesting because part of me feel like because they do circus, it's actually helping the shoulder pain. But when they get injured on the actual shoulder structure, the rehab is really tricky because they have the proprioception of how to use it. It's everywhere. The scapular instability goes very quickly. And then you're like, oh my God, this is fixing, that is fixing, this is not fire, the serratus, oh, and then the conversation around when to stop, how much time you rehab and how much load and how much hours you spend climbing or doing hand balancing. I found that I'm still learning to navigate that because each case is so different. And the shoulder is such a complex structure. The hypermobility can display differently as well. So yeah, it is fascinating, but it also is a bit of a problem-solving kind of a case going on.
Yeah. And if you have somebody who's like hanging from an apparatus normally, it's not like you can say, well, only do 50% of your body weight for that. You can't
You can't do that. And you can't be
So
like hang a TheraBand on the hoop because they'll be like, what you on about? Yeah.
yeah,
Yeah.
definitely
Really
a
like
different
have
approach.
to take them out of you actually need to stop doing these crazy jobs and go back to like really simple activation work. And I think that's sometimes quite hard for people who are so young and active, training 6 hours a day, and then you're like, what? I need to do this TheraBand exercise for 25 times before I even jump on the hoop. I think that's like
Mm-hmm.
the bit that you also have to like reset their expectations.
Yes. Well, and I find that, I mean, especially with folks who are hypermobile, but just in general, a lot of times it is that like just figuring out the activation and where they are in space and like how do I actually get that muscle to do what I want it to do? Um, because they're so used to pushing themselves into specific positions or weird ranges of motion or that kind of thing, that when we take some of that away, then it's kind of like, but what am I supposed to do with my arm now? I don't know. Have
You
to
know, the
relearn it.
more you make them aware, the more they're like, I don't know what this is doing right now. Is it like
Mhm,
this to put it in the socket, or is it like this to put it back in the
mhm. And sometimes it's hard to find the balance with somebody too, where like
socket?
I'll have some performers that are really in tune with their body and we can have those conversations and they can figure it out, some a little more easily than others. And then I have some that are like hyper aware of their body. And so if we start getting into some of those details, they're like, ooh, I don't like that it moves that way. Or like, why is it, why does it feel this way? And so finding the language that's helpful for the performer without freaking them out if they're prone to be that direction,
How would you
sometimes is
do
part of
that?
the
Because that
challenge.
is hard. I found,
Mhm.
especially with the neurodiverse spectrum, sometimes is even harder when
Yes.
some are more kind of black and white type and
Mhm.
no perception at all. Yeah, how would
Mhm.
you approach it out of curiosity?
I mean, I do a lot of things where like, sometimes it's almost being a little bit sneaky with some of the movements of getting them to do it without realizing that they're doing it, or doing more external cues versus internal, like, does it feel like this, sort of thing, and maybe focusing on, I want it to be parallel to the floor, or I want it to, something like that. And then I also do a lot of, in my old clinic space, I had mirrors on the wall that I had curtains for, and
Okay.
so sometimes we'd have the curtains open so they could use the mirror, and sometimes we'd have it closed so that they couldn't do it. And we might flip back and forth and, kind of play around with some of that too of, okay, you can see it. Now can you feel it in your body? Now can you do it if you can't see it? Let's find out.
That sounds super fun.
Mhm.
Yeah, I do like external cues. If in doubt, change your cue to external cues.
Mhm. Yes, most definitely. Yeah, I had one dancer in particular who, when we were working around her knee and moving the patella or the kneecap for our non-medical folks, checking its mobility and stuff, and she would just get so freaked out by the fact that her kneecap could move
Moving.
like that. Um, and so it was interesting helping her through that rehab process because it was something we needed to work on, but it also totally freaked her out. And so, it's like, okay, well, tell me about, she was really into a couple of different like music artists or shows on Netflix. And so it's like, okay, so get on your phone, find a song for me to play from that artist that you really like while I'm down here keeping
Yeah,
you distracted.
yeah. Well, I guess in a way you're like regulating the nervous system as well, right? If there's so much hypersensitivity, it's just the thought of the kneecap wiggles,
Mhm.
move left and right. Just having that music probably does help calm her, and then the body's
Mhm.
starting to learn that, oh, actually, this is a safe movement. Actually, this is how I need to like activate my quads and so on and
Yeah.
so forth. Yeah,
Gotta
I'm
use
taking
old
notes of
school.
all the tricks.
Let's see. What kind of thinking about pain for performers again? We've been talking about sort of normal pain versus not so normal, or what is expected when we're trying something new versus something where maybe it's a little bit more of a problem. What are some things that you often tell the performers are signs that, like, okay, no, you should see somebody if you're having this kind of pain?
I generally tell them that I actually have like a table to send them as well.
Mm-hmm.
Of like what is classed as good pain and what is classed as bad pain. Like I know like you can't really measure pain by scale, but I do say if 10's the worst pain ever, about 1 or 2 that kind of comes and goes kind of okay. And pain that happens the next day, like a muscular pain, that's okay. But if pain that doesn't go away and that's higher on the scale, or if you have pins and needles and numbness and changes in range of motion, like, oh, I'm not in a lot of pain, but I can't lift fully the way that I used to, that is something to get some medical opinion on, to just get it checked out. Because I think a lot of the time, pain is so subjective, and this no pain, no gain mindset. I have high pain tolerance because I'm a dancer. I'm a circus artist. Does make it create almost like a barrier to see where the body is at. But I found range of motion sometimes doesn't lie. So that's a quite a nice one to notice, and something around monitoring the pain as well, whether the pain rises up after training or rises up the next day. That again is not something that's what we call like normal good pain.
Mm-hmm. Yeah, I think all of those are good.
Where they like can say, okay, yeah, this is not normal, I need to go check it out.
Mm-hmm. Yeah, I know. I mean, when I start thinking about it, so many past patients come to mind, but things where it's like they were trying a new skill and got pushed a little hard and they felt a pop and then they couldn't, lift their leg anymore.
Was that like a hamstring one?
And this was a labral tear. A dancer who was training splits at a place that trains them on yoga blocks. And so it was overstretching them and then manually pushing them further into the stretch. Felt a pop, couldn't move her leg right anymore. And then, a couple of weeks later, calls and goes, "Can I get back on your schedule? I think I need to be seen for something." It's like, oh, yeah, we should have started this a little sooner, maybe.
Yeah, I think popping, clicking is another like indication.
Mm-hmm.
That's not normal, like hearing a snap sort of thing.
Mm-hmm.
And they would move their legs properly, like before.
Mm-hmm. Yeah.
Anything like a long time, isn't it? Rather than like, I would say wait for 2 days max, but people wait for weeks.
Mm-hmm. Exactly. Yeah. And I find a lot of times, especially with the dancers that I work with, particularly ballet dancers, I feel like they're so used to some popping and clicking in various places of their body and various joints that has been normal and is typically not painful and that kind of stuff. But then they start getting weird ones where like it didn't do this before, or now it hurts when it's happening, or instead of my hip only popping once a day, now it's popping like 10 times a day, and that sort of stuff. Those are all good little indicators, I think, too, of at least checking it out, even if it doesn't require weeks and weeks and weeks of treatment. At least check it out and make sure before it becomes a bigger problem.
Oh, absolutely. Because like, the thing is, a small problem can like build and build and build, becomes bigger.
Mm-hmm.
And I don't think sometimes people know just resting of it is not enough, because you start to get deconditioned. You might alter like your movement pattern and compensation, and then you get pain other places, and not worth it. Just check it out if you're listening to this podcast. Yes. Down, check it out.
I love it. That should be like the tagline for all dance and performance physios. When in doubt, check it out.
Sometimes I feel like a closer friend, they would just like send a picture to me and be like, "What is this bit of this bit?" Like at the end, they've got like a picture of a knee or a picture of the ankle. I'm like,
sounds right.
Looking at a picture of a kneecap is not gonna be an assessment.
Yes, I need a little more information. Yeah, one of the things that I really get interested in and passionate about working in this community is the idea of like checking things out early or even establishing a routine with providers when they're not having a problem. Because it's one thing if I can see a performer whose leg needs to go all the way up to their ear and I've never seen them before and I only see them after they have a massive hip injury
No
versus
baseline, isn't it?
if I could see before and just like, okay, what is your normal? And now I see this change. It gives me a much clearer picture of where they were, where we need to be, what the process might be along the way. And we have opportunities to maybe catch things if it's like, I feel like your leg used to go here, but now that we're doing this, it's like a little bit lower. Have you been noticing anything? And kind of help keep tabs, keep track of what's changing before, again, it becomes a bigger problem or they get injured.
Yeah, I think in the perfect world, that would be great. Like screening days is really helpful in that regards. But in like the amateur communities or even the professional communities, it's really hard for them to justify or have that buy-in when the bodies are doing relatively okay. I find it really hard to have that awareness and that kind of push that forwards.
Yeah. I always get very excited when some of my clients get to a point where they're feeling pretty good and now we're just working on programming things and maybe improving some technique, but we're not really
like
trying
that
to correct. Yeah, exactly. The fine tuning of things. And they're like, you know what? I want to do like a monthly check-in for now. And I'm like, yes, let's keep that going. Let's keep the momentum going and keep checking in for a little while. That's when I get really excited.
Is it mainly ballet dancers that you see? Because I know that you see a range of pre and professional dancers.
Yeah, so it's a range of ages and styles. So I'd say the majority of my clients are adolescent competitive dancers, maybe leaning a little heavier to ballet specifically, but definitely a range. And then I have professional dancers, including, Irish, and I had like a professional flamenco dancer that I worked with and different things like that. And then I also am a dancer myself in the West Coast swing community. And so I'm often treating some of those dancers and I'm set up on site during competitions in town and that kind of stuff. And so I see everybody from, people who started a week ago and are just getting into the style of dance all the way up to the international champion level dancers that maybe need a tune up. So it's fun being at those weekends and like you in circus, like when it's something that you already have a lot of familiarity with and something that you love personally, I think it helps me dig even deeper into the stuff that I'm doing with that person that's in front of me because I know like, oh, there's this move that you need to be able to do and I know what it's supposed to look like or some of the technique that's supposed to go into it. I can get to the root of the problem a little bit faster than somebody who's like, wait, dancing? I know nothing about dancing. Tell me what's happening.
Yeah. I was just thinking very similarly with the circus community. That's what we do in London. There's this like massive convention every year and we just have a little stand there. But it's super awesome because you'll be like, okay, if you have this problem, and because you know the discipline, when you know the discipline really well, you know how much load and how much repetition they do in that movement. And it makes you like the targeted like treatment approach much more specific and much more relevant. And I think that's probably why like there's such a big bias treating that population because I can see results because I know what they need to do. And that really helps for sure. And also they feel like you understand their demand as well, which helps too. And I'm constantly fixing my own body. I'm constantly like, what's my pain score now?
Yeah, a lot of times when I'm set up on site, at these swing dance competitions, I'm also competing that weekend. And so I block out my schedule when I'm competing. And so it's like, okay, well, I'm not available from 2 to 3 because I need to run into the ballroom and do my thing. And, then I'll be back out. But yeah, so it's like, no, I'm not just saying that like I get this form of dance. Like I'm literally about to go do this.
Doing it
And
on there. There's me running between the convention, but I want to do this workshop.
Exactly.
I'm quite lucky because I'm not the only one, so I could sneak out and do the workshop.
So we've talked a bit about your work specifically at the National Center of Circus Arts. You also have your own clinic, Flexibility Matters Physio. Tell us a little bit about what you do there.
So Flexibility Matters Physio, it's just a physio clinic targeted for like active individuals and to performer. So we see a spectrum of people who are maybe just office worker, amateur, but do like a lot with their body. I think it's because of the name of the brand, Flexibility Matters. We do attract a lot of hypermobile people, also the people who wants to get flexible. So we see pole dancers, we see circus artists, and we see musicians as well. So that's where my other bits of performing arts clinic is. And I feel so lucky because we also have they're my friends, but they also help me run the clinic. They've really experienced in like circus discipline. They all both did circus themselves, so we all just kind of gelled together of like, okay, a bunch of circus nerds and a bunch of physio cares about movers, flexible people come together. And yeah, so we have a clinic that's based, we're actually moving. We used to be in the back of the circus school, but there isn't access to a big enough gym that we wanted. And so we're actually moving next month. So that's quite exciting. We're moving to in London. There's a place called London Bridge. Everyone knows the song London Bridge is falling down. So we're moving there, which probably it's very exciting. There's a huge train station there. We've been seeing actually people who's traveling like an hour and a half or 2 hours to come see us. So that's a better location. And there's a huge access to like a functional training, dance room. So yeah, it's very exciting.
That's amazing. And it's so cool that you do get like the variety of folks that you get to work with and that you have a team there that all can help out and see different people and that sort of thing. That's awesome.
Yeah, it's not easy building it, I would say. I never imagined it to be a team. I've always thought it's just going to be me because I think a lot of physio that I connected with when I first started going to performing as well, a lot of them are like sole traders and freelancers. They freelance for the school, or they freelance for an organization, they freelance and work with musical theatre, but there's not much like actually company that's specific for performers. And when you tell other physio, they're like, surely you can't make that work. Is there enough performers out there?
Exactly.
And it's just through finding the right people who has the same energy. I think that's what made it so special, and that's what's made it become something bigger than just a one person thing. But still, we still have we're still learning loads. We're still facing lots of problems and learning how to navigate them through. But I think as long as it's in the right direction, we get to see more circus folks. I think that's pretty cool.
Yeah, I love that. Yeah, I recently made a switch so that now I'm full-time faculty in a physio program. I still have my clinic running that is technically still just me under my company, but I'm contracting out of a space that is another PT clinic and multidisciplinary clinic and gym and all of that sort of thing. So it's weird, like,
that, isn't it? Yeah.
I don't even know. It's just like this mishmash of all sorts of things now, but it's really awesome because it helped me get access to some things that I didn't have access in my clinic before, with it being just me and, trying to be reasonable with the costs of things and space and all of that kind of stuff. But we still can have this interdisciplinary thing. We also can share clients if appropriate. So now one of the physios in the space is a pelvic floor specialist. So I've had some clients that I refer over because that is not a specialty area of mine. And so, yeah, it's nice because we can just kind of allow our clients to work with who they need to work with at the time. But it's fun to have all of the different, like teaching the students and working with them on physio specific things, working with the dancers and performers on the clinical side,
there's
doing
no like
things like the
interrelational
podcast.
skills as well, isn't it?
Mm-hmm.
Yeah.
Exactly. So speaking of podcasts, I know you also host a podcast of yourself. So tell us a little bit about your podcast.
The podcast started because I torn my ACL. I still laugh about it because I torn my ACL. I knew at the moment I torn it, I'm like, with my physio brain, this is ACL tear. I need to go get an MRI scan. I need to start my rehab today. Anyways, as a result of tearing my ACL, I was really upset because I'm really finding my work-life balance as well. So I still train like 4 times a week, like circus-related discipline, sometimes 6 times a week. But I try and pace and have my rest days as well because recovery is just as important. But at one point I decided that I actually need to go for surgery because I was just keep getting instability despite how strong I'm getting. So when I had the surgery, I had 6 weeks off. It's meant to be 10. No, it's meant to be 6, but I end up having 10 because I have an infection. So within that 6 weeks, I think it's around the first week or so, I think emotionally I just found it really challenging. And then I had a psychologist, like with a sports psychologist, and said like, this is so sad. Like I spent like a whole year at that point, started working with the circus and all of this, and now I had to force to stop. What am I gonna do in my life? And so one of my really good friends from Accra, she's a nurse and a yoga teacher, and she mainly does like women's health because she's like a perinatal specialist nurse, pre and postnatal. And so I was just talking to her about how upset I am. And as a combination of speaking to her and then speaking to the performance psychologist, and they're kind of led me to think, okay, how can I still share like insights or values or things that is good for the acrobatic community? So I had a chat with Mary while I was like crying, and she was like, why don't we just do a podcast? She get injured all the time because she's also an ex-dancer, ex-ballet dancer and acrobat yoga teacher. And then I'm a physio, and it just felt like the energy was right. So I was still on my crutches when I was recording season 1. She came to my house and we learned to speak to the camera without laughing too much and feeling cheese about myself. So that's how it started. It's wild. And then as we started to share with our circus community, and then people were like, actually want to be guests. And we're like, is that a thing? Okay. So it's a very organic process with the podcast. So we're on season 3 now. We finished all the filming last December. And I think we'll have a pause because I'm building a clinic and she has other courses to do. But we'll probably do another season later on the year. I think the best part is actually having conversation with different guests. Yeah, it's going really well. And the handstand ones, it's numbers. Like injury related back pain is like low, and then you have a handstand and everyone's like listening to it. And I can just see where I'm like, it feels like people are actually more interested in learning about handstand biomechanics than injury. But we're like drip feed it in, you know.
Yeah, it's always wild what becomes the more popular thing or something where it's like, you know, I'm like, I'm really interested in this one, but it hardly has any views.
I know. Yeah, so yes, I do have a podcast. That's one of my many little side projects that I have. It's nice. It's a nice project.
Yeah. And before we started recording, we were talking about how it seems like a lot of times people in the performing arts medicine world do tend to be very busy in a lot of different ways. It's not, I don't know why that is. I don't know if it's just because we're really passionate about what we're doing and the community that we're serving, or if there's something else to it. But I feel like that's just very common.
It is, yeah. I think when you're really passionate about something, the energy comes naturally and you have to fight for it and the motivation comes naturally. I think that it's certainly for my case. It just makes it feel like it's, you know, easier. And outside I might think, yeah, why do you do so much, or I get confused about like all the things that we do, because I think a traditional physio either like do a ward-based work or outpatient work, so it's quite easy to explain what they do. But instead, I'm like, yeah, I do a real circus, or I have a podcast, I do circus myself, or I have a business. I also sit on the board of Watch Your England, and
yeah, if anything, I have to tell myself, like, you need to take some time off. You need to not do all of these other things.
Yeah, I think you sound like you do more than I do.
Just stop saying yes to all the things that sound interesting.
Yeah, pace it out, delay the date, do it later. It's never like, do it now. It's just do it later.
Yes, exactly.
But they're all like, what you doing is all interlinked with each other as well. So I think that's probably similar in my case. I do feel like, yeah, the podcast actually links to the business a little bit, and the circus work links to people. People do probably quite like it that they have a physio who also work with the Circus University. So I wouldn't change what I'm doing just because I'm doing varieties.
Yes, I would agree 100%. On that note, I think it's a good opportunity for a special segment on the show.
Ooh.
So in every episode of Dance Med Spotlight, we have the final bow, which is basically the take-home message. So for people who have listened to all the things that we've talked about, what do you hope they walk away with?
I think it's when we're in the middle of the conversation, when we're like, if in doubt, just check it out. Because we can go on about all the long list of things that might be a good pain or a bad pain. But the more you're like not sure what that pain is, that in itself, you tense your body saying it, like, I'm scared. Like, you get tense. Like, it affects your nervous system, affects how you regulate yourself, affects your movement pattern. It's just not worth it. So the sooner that you can get the right help, and I think the better. And I think even as dance physiotherapists, we're quite good at signposting things as well. So like you said, MDT working, it doesn't have to be a problem that we need to fix, a pelvic floor thing, but if we can identify whether you need help for to see the doctors for other things, or whether you need to go to speak to an orthopedic specialist or get women's health physio support, I think just getting that first step of acknowledging that there's things that can be better for your body. And if you're not sure what that is, like, come speak to me, speak to you, and then we'll get it sorted.
Yes, I love that. And then last and certainly not least, we have the shameless plug. So this is your opportunity to promote anything, anyone, any organization that you want. So the floor is yours.
If you are looking for a physio in London, please just send us a message. We don't bite. You can always just come in for a cup of tea and come and do a little bit of training with us. So the best way to find us is on our Instagram. We're very active there. So it's flexibility_matters. I do post my training too, because I don't want to spam my friends. So I thought I'll just spam the business. So that's the best place to look for us. We also do online consultation as well. At the moment, this might change. We don't take US because of insurance reasons, but we do take other countries as well. So yeah, come check us out on Flexibility Matters, because flexibility does matters.
Yes. Wonderful. Well, thank you so much for your time today. It was great getting to chat with you.
Yeah, thank you so much for having me.
Dance Med Spotlight is hosted and produced by Alyssa Arms. We discuss all things dance medicine. This has been another episode from Dance Med Spotlight. The Dance Med Spotlight is intended for educational purposes only. No clinical decision-making should be based solely on one source. While care is taken to ensure accuracy, factual errors can be present.